and welcome to the Unspoken Medicine Podcast. I am your host, Dr. Sherron Colgram, and I'm excited that you came to the office today. Thank you so much for listening wherever you love to stream your favorite podcast. But do me a favor, subscribe to our YouTube channel, and also share this with someone that you love very much. Today, we have an extra special guest who I love so much. I have a little intro here for her. So let's get to it. She is a beloved mother and grandmother whose kindness and warmth have touched the lives of so many. She's a woman whose heart is as big as her spirit, offering love and respect to everyone she meets, no matter how they treat her. Her story is one of incredible resilience, deep compassion, and a commitment to make a difference. Currently working as a business correspondent for a large healthcare system in Massachusetts, she's here today to share her personal journey and offer insights into the unspoken medicine. We are honored today to have my mother, Miss Madre, Sandy.
Hello. Thank you for having me.
How are you doing?
I'm doing fine.
Good. Now, I know you get interviewed on a regular basis, so this is nothing new to you.
All right. If you say so.
All right. So I really want to start the conversation just really open-ended, and you just tell me where you want to go. Tell me about your journey with medicine.
I've had just a teeny journey. I had wanted to be a nurse when I was younger.
A nurse?
Yes, a nurse.
No, why you never told me this? I never heard this before.
I just didn't really tell anyone, but...
Okay, and why a nurse? Out of anything you could be, why a nurse?
Because nursing to me at the time let me know that it's something that you can do to help others.
Yeah.
And to be compassionate and kind with the people. So that's what I had endeavored to be.
Okay.
But...
So you were taking classes for that, or?
Yes, I was going to Hunter College in the nursing program, and I had to stop because I went to classes, but I was pregnant at the time. And then I just stopped and put my mind on my daughter at the time.
All right. When did you kind of like decide to go back to work?
Well, what I did was, I just was, when my daughter was 7 months, I decided to move to Massachusetts with my grandmother.
Okay.
And so I was here, and before I had left New York, I was working in retail. So when I moved here to Massachusetts, I started working in an insurance company.
Okay, so that was new.
That was new. It was new for me, the insurance company. And as time went on, the insurance company was going to be moving, and I wasn't able to relocate at the time. And so what I did was I looked for another job, and I also looked for I went and started taking clerical classes.
Gotcha. Tell me about the insurance company. Was that just like health insurance or car insurance? Like what type of insurance?
It was both.
Okay.
Auto as well as medical. So
how long were you there for?
I was there for about 10 or a little more years.
10 years in the insurance company business?
Yes.
That's a long time.
Yeah, I was working in medical records at the time.
Okay, and did you over time build more skills that moved you up?
I built a lot of skills in the medical records department. I learned all the different things, the ins and outs of working in the medical records department, because you can work, and if all the skills that I used, you could take that and take it anywhere, because all companies have a medical records department.
Gotcha.
Of some sort. So you just would have to learn their way of how they handled their business. But basically, it's the same wherever you go.
So you were very seasoned.
I was.
Like, you were basically running things there.
A little bit.
Okay. Yeah. And so the company moved, and you decided you were going to take another job somewhere else. You like
Yes, but at the time I didn't find one, so I just did school.
okay. So you were taking classes for
Clerical.
clerical classes.
Mm-hmm.
What does that entail?
It's like business. You learn how to some of working in different medical things. You learn to type. You learn to speed writing. You learn all different kinds of things. Bookkeeping, all of that.
Okay.
So
So then you learned all these skills, you had that, and so then what was next for you?
what was next for me is that I got a job at a hospital here in Massachusetts, and I've been working here ever since.
How many years is that?
Over 25. So, but going into 26 now.
That's a long time.
Yeah, it's a long time. You shouldn't be going all over, jumping from job to job to job, unless for some reason your jobs are moving and you can't accommodate
Yeah.
them. But I mean, I think it's good for you to be able to do your best of your ability where you are. And should you move up in the place, then you do. And if you don't, you still be the best.
Yeah. I feel like there are a lot of nurses that I ask the same thing because they're like at a job for like 20, 30 years. And so I guess my question is always, is it the job or is it the person? Or a little bit of both in terms of staying for so long?
I think it's both because you find that it could be something that you love and that you are doing the best of your ability and you see where you are helping. And then again, the job, if you work hard at a job, sometimes the job doesn't want to let you go. They want to keep you.
So they didn't let you go?
No, they didn't. Because I even had called HR one time and said, do I'm supposed to stay here? And she said, yeah, if you don't have a problem.
Wait, where was that though?
And they say,
No, but like why? Like what happened where you were like?
because I was like thinking that I should be going to another department or should I be what? And they said, no.
Did you want to go to another department?
Well, no, I just was wondering. I was like, I was doing more work than the people who was full time. I wasn't even full time and I was working full time.
Oh, okay. So when did you become full time? Like how long were you working there before they saw all your skills?
4 years after 4 years.
Okay. Was that a long time?
Oh, yeah, that was a long time.
Yeah.
Yeah, that was a
Okay.
long time.
All right. So you were there for all this time, 25 years. Like, have you kind of still done the same thing?
I've done several different things. I've been a patient service rep. That's where you register the patients when they come in for their appointments. I've done billing. I ran the billing department that was in our office. I've done the medical records. I've done all of that. And now I'm back again into medical records of the patient service rep area.
Tell me what a day in the life of CND is right now as a business correspondence rep. What does that entail?
That's what I would do is every morning I would pick up the paperwork that come in from the different patients, bring paperwork in that they need filled out, like their FMLAs, stuff for their that they may need to take to their workers, the different agencies they have to go to, and they need to bring paperwork in to be filled out. So for those agencies, we would have paperwork for school. The kids that go back to school, you need all their immunizations and type of stuff. Did they get their medications? Did they see the doctor? Do they need anything extra because they have asthma and they may need certain medicines and they need it for school as well as home. So scripts to be faxed out to the different DME companies. before
DME, you mean like durable medical equipment?
Yes.
Okay.
Because we used to fax all the DMEs, and then we also faxed the regular medication. But now that medication scripts can be automatically sent in, we don't have to do those. But for the DMEs, we still have to fax them to the different locations. So there's lots of paperwork that you wouldn't even believe that we have to entail. And so what I do with those is once the provider has signed them, I fax them to the various places, or some get mailed to places, or some are put in the front for the patient to pick up. So there's different things that happen with the paperwork that we have.
That seems like a lot in terms of organizing what goes where, making sure,
It can be overwhelming. You just have to put things in order, different sections. This goes here, this goes here.
So for example, for a piece of paper that comes in, a patient brings in a paper, what is that process in terms of it getting back to the patient?
The process of that is the patient brought
I walk in and I drop it at the desk. I need my doctor to fill this out. How my paperwork get through and get back to me?
Okay, your paperwork will, you will fill out a release form. The release form is attached to the paperwork. The paperwork gets all your information, your numbers and all that on it. Your provider, who he or she is, that is then put in the provider's mailbox. If it's something urgent, that is brought directly to them if they're available that day. A message does go to your provider that the paperwork is on their desk or in their mailbox.
And who's doing that? Is that you?
No, that is not me. That is my coworkers, the one lady at the front, and then we have others that some of them may need to get numbers on them, and then it'll go right to the doctor. The doctor has 7 to 10 business days to have that paperwork completed.
Like on their desk? Once it hits their desk?
Once that particular day that the paper is brought, that's day one.
Gotcha.
That paper gets to the doctor, and then he or she, however, whenever they're in office, because everyone's not in office all the time, they will complete the paper however they need to do. If all they need to do is sign their name, or if they need to put information along with their name, all that paperwork is signed, finished, completed. Then they put it in the space where I pick it up from, and then I process it however. Make copies, photocopy it, fax it to wherever, or just make a copy of it to go in the patient's chart, put the original in an envelope, and put it at the front for the patient.
So the doctor gets it specifically on the day that I drop it off, and it gets on their desk?
Uh-huh.
And then that's day one. They got 7 to 10 business days for it to be on their desk to get it done. And then they put it in the slot for you to pick up. So it usually takes you a day.
A day.
Okay. How much paperwork would you say is running through?
Oh, quite a bit runs through. There's some days we could have, I don't know, 300 pieces of paper, or we could have 400, 600,
On average.
Yeah, on average.
Would be like 300 or 600? 300 plus. That's
because we also get paperwork in the system now. It comes through the system where it comes and it gets printed out to go to the doctor to sign, and then we get it to fax it to wherever.
Is one way faster than the other?
No,
it's all the same.
It's all the same.
Doesn't matter.
It doesn't matter.
What are the type of things that will be considered urgent that will get to their desk? Like, boom.
It all gets to their desk.
No, you said some stuff is urgent.
Well, I could say like FMLAs, or the things that need to go to certain agencies are important quickly. School stuff is quick, where they need the medication forms. School forms are quick, but that doesn't necessarily make it done in that timely manner, because providers have other things that they need to do as well.
So if you knew that you needed some paperwork to come through, like, what would you say? Like, say I need it on, set date. How many days before?
As soon as you get that paper from wherever you get it from, you need to bring it in if it's not that day, the very next day.
Okay, so don't hold out to y'all paperwork, is what you're saying?
Yes, don't hold on to it.
Okay.
Get it to your clinic as quickly as possible.
Mm-hmm. Now, some people don't really have the experience that you have, but you have the experience of working with doctors in training.
And I call them residents.
Residents.
Yes.
Yes. And did they always have residents
Yes.
there?
Mm-hmm.
Since you worked there the whole entire time.
Mm-hmm.
So you know a whole bunch of physicians.
Mm-hmm.
Like through the years, like you've seen them all.
They come and go every 4 years.
Yeah.
A few may stay if they're, I don't know, if they have that extra that the clinic needs, they get to stay.
What's the experience working with residents?
It's very hard. Some of them...
What's hard about it?
Because some of them come in arrogant.
Oh. We come in arrogant? Not us.
Some come in arrogant. Some come in as happy and sweet and kind and loving and just everything that you want the person to be when they're taking care of the patients.
Mm-hmm.
Some write terrible. You can't read their writing. You don't know what they wrote. When it's their name, it don't even look like it is. It's a line. So, I mean...
But that's a signature. We shouldn't have a legible signature if somebody could steal it.
Well, even if you don't have a legible signature, someone will try to steal it. It doesn't matter.
So you say you work with tons of doctors. What kind of advice would you give to, a doctor coming in? Because you said you have all different personalities. What would you say would be the best in terms of give them the most success?
Well, what I do is I look at them to see that first of all, they're away from home and they just left school. They had to figure out where they want to go. Some of them flew in and had to find somewhere to live. And you have to think about all of this stuff that has happened to them in that little bit of time. And then now they're here, they're seeing 50 of us and don't know who we are. And so you have to be kind to them because some of them need a little nurturing to, just be happy with them. And I had to always think, like, for you were away doing the same thing that they're doing. Mm-hmm. And I was in hope that someone was kind and nurturing you. So I said, well, these ones, I have to be kind and nurturing them like I want someone to nurture my child. Mm-hmm. So that is why I'm extra sweet to them. And if for some reason I see them not in the best, I say to them, are you okay? Did you have a bad day yesterday or today, this morning? How's your day going? Okay, we're going to have a day. Good morning. Let's go. Chop, chop. Let's come on.
Chop, chop.
Chop, chop. Yeah, what's happening? Did you have your coffee? Do you need some? We got some upstairs. You have to give them that boost, and then you'll see how they are. And some of them look for you to do that when they see you. And if for some reason you're not happy, they'll say, are you okay? Is everything all right with you? So you have to make some kind of rapport with the people to get to know them. And I guess it helps them. I mean, 4 years you got to be somewhere for 4 years. And now and then you leave and you got to be somewhere else for whatever amount of years you're done. So it's a lot for residents.
It is a lot. So you started to kind of talk to us about your first pregnancy. So I want to know all about that since, I'm an OBGYN. So I want to know all about the labors and all of those things. You said when you were in school, how old were you at that time?
20.
20 years old. In school, find out you're pregnant, having your first child. Like, what was that?
That was a whole learning curve that you learned something and it was very, it wasn't traumatic. It just was new. Everything was new because you didn't know anything from before. You had to learn like on the fly. You're learning everything on the fly because you don't know anything.
And your first baby was on a holiday.
Oh yeah, I did. I had one on Christmas Eve.
Yeah, so she was a Christmas Eve baby. What is the experience of having a baby during the holidays on Christmas?
Well, I was a little sad that I was in the hospital.
Why?
Because I don't know. I just was there. To me, I was just in a room. And I think I was in a 2-room. And what sparked me up and made me happy is that my grandmother came all the way to New York to see me in the hospital. And she came with boxes of gifts for me on Christmas.
That's nice.
That was very nice. I was so happy to see her. Yeah.
Did you go into labor or were you induced? What was your situation?
My situation for labor was not, I thought it was, I don't know. First of all, my water broke at home. I was babysitting because I was with...
How'd you know your water broke? Who told you that? You just said you didn't know nothing.
Because my cousin was a nurse.
Oh,
She's since passed. But my cousin was a nurse.
I didn't know she was a nurse.
And she had told me that so you could know whether the difference between your water breaking and is... She gave me a mason jar. And she told me to keep it in the bathroom. And I had the mason jar in there. And so she said these last few weeks, she wanted me, if I had to pee in the mason jar. Because the mason jar would show me if it was my water or if it was pee.
A mason jar?
Yes, because the...
Wait, was she an L&D nurse?
No.
What?
She wasn't.
A mason jar?
Yeah. So I would pee in it. And
Okay, community. I need to know from all the L&D nurses. This is what y'all was telling people to do. So I pee in the mason jar. Wait, every time you peed, you had peed in the mason jar?
Yes, because in the last couple weeks of my pregnancy, getting closer to delivery, I said, how will I know if my water broke? I wouldn't know. And she said, you're going to pee in the mason jar and you will see.
So
if it was
yellow, then it's pee?
Yes.
If it's what color?
It was like a clear, cloudy with little speckles of tissue paper, looked like snow, kind of like.
Ma, seriously, you pee in a mason jar for how long? How many weeks are we talking about?
The last 2 weeks. So you figure I delivered in
the same mason jar?
Yeah, you have to wash it.
So because I'm the germaphobe, so
yes.
I'm just trying to understand. You peed in the mason jar and then you would wash it every time you peed in the mason jar. Mm-hmm. What'd you do if you was out somewhere? You wouldn't pee in the mason jar?
No, I didn't. Mm-mm.
Okay, wait. So if there was any other color other than yellow, it was a problem. It was the issue.
It was, yes. I would have to.
But did she tell you what it was supposed to look like?
She said it would be clear, but it would be cloudy or clear with some little white particles. And that's what I had.
Snowflakes?
Yeah, like.
So it was Christmas time and you had snowflakes.
In my yes.
Oh my gosh.
And when I went on myself, it was warm.
Okay.
Warm.
Yeah. Was it the splash, a wave, or
warm rush out?
And just warm rush out, and just kept going.
Yes, it just whenever you would walk, hair is coming out.
Okay, so then you got to the hospital, and then what happened?
I got to the hospital, They take you in, they have you in a wheelchair, and they bring you up. And I wasn't in no pain or no nothing. I got in there. I think I was in like the section was like 4 to, I don't know, for some reason, it was either 4 to 6 people in that area. And in that area, people were just coming in. So, and I still wasn't having no pain or no nothing. I was just laying there.
So almost like a triage
I think
situation.
It was. Mm-hmm.
Okay.
And then people came in and they went out, and I was still in there. And then I said to the nurse, I said, I've been here a long time. Am I supposed to go now? And she said, no, it's not that way. It's when it's time for you to go, you're going to know, because this is not, you don't have, it's not, you're not ready yet. And I was like, I'm not ready yet? She said, no, you're not ready. I said, okay.
You were there by yourself?
Mm-hmm.
Okay.
My cousin came later, but yeah, I was by myself.
Okay. So then you finally it was your time.
Yeah, finally it was getting close to my time. Mm-hmm.
How you knew it was close to your time?
Because then the nurse came, kept coming in there. And then when she came, the last time she came, she said, well, we're going to prep you now and get you ready for your delivery. And I was like, oh, okay.
Would you have been pain then by that time?
Just a little, but not really.
Did you, but was like, it was active labor, like
Yes.
was contracting.
Yes.
But you did was like, no, I'm good, I'm chilling.
Yeah.
So you was one of those stoic girls.
Yeah.
That would just be looking at you like, that was you?
I don't know if I was looking at them like that, but I was looking because I was wondering why I hadn't left. That's all.
So they was prepping you for the birth. What did that mean?
Well, what they did was they shaved me. They said they had to shave me.
For what?
Before I went into the delivery.
Oh, okay. So we don't do that. We don't do that anymore. So like before, I guess the thought process was like,
yeah, because
the hair harbored like bacteria and stuff, so it decreases, risk of infection and stuff. So they would say, well, we don't do that anymore.
Yeah, because they didn't do that for me when I had you.
More. So don't worry.
So.
Okay. So then that was easy.
Yeah, that wasn't too bad.
Okay,
so that was in labor a long time though.
That was pregnancy number 1. Now, pregnancy number 2.
Yeah, that was 18 hours.
That was me.
Pregnancy 1 was 18 hours of labor. Pregnancy number 2, 24 hours of labor. Pregnancy number 3, no labor.
Okay. So what happened with pregnancy number 2? Still have the same thing?
No.
No, that was different too.
Mm-hmm. Mm-hmm. Yeah, they were all different.
This is good because same person, but you had different labors for literally all 3.
Yes.
We're all different. So
right.
that happens.
Yeah. Yep.
And like me and Patrice are 9 years apart-ish. And then me and Sheena are 3 years apart.
Mm-hmm. Sheena was just a straight section.
C-section. So
that was booked.
You got a book C-section. So I'm assuming with me, I was C-section.
Eventually. After all the labor that I had, because what happened was that morning I went to the doctor for my doctor's appointment and everything was fine. I was sent home. Everything was okay. I was a little tired. I said, okay, I'll just take a nap. So your dad went back to work after dropping me off. Mm-hmm. I got into bed and I was going to sleep. And then when I woke up, my whole bed was full of blood. And I had to call your dad and call the doctor, and they wanted me to come right in. And come to find it was I don't know, it was some kind of blockage between my uterus and between my placenta and something. It was some blockage. So that's what was bleeding. But anyhow, then I went through, they admitted me and I was there. I wasn't in labor yet. They were just trying to make sure the bleeding was not you or on your side.
Mm-hmm.
And so it wasn't, it was on my side. So that was all fine. And then finally, they had me walking around. I did get Pitocin with you. And so I had that, and that is the worst thing ever.
It's not the worst.
It is so,
What's so bad about
the pain is so bad. I had pain so bad. I was like this and like that and like this and like that. It was terrible.
People do fine with it.
Eventually you do fine, but I tell you, you have no choice but to do fine.
But it's getting you through the labor process. So it's not going to be like,
right.
Roses.
No.
It's going to be labor.
It was labor.
It's going to be painful.
So I had that. And they had me walking and standing and pushing around and moving around and doing all this. I was on a ball, like an exercise ball. I was on all kind of things.
So then why'd you have a C-section? Did you get to push?
I did get to push, but you wouldn't come down.
Okay.
They said I was too narrow.
Okay.
Actually, yeah, they said I was too narrow. So.
But you had a baby before.
Yeah, she was 5'10" and a half.
Mm-hmm. So she was 5'10". How much did I weigh?
8 and a half.
Okay, that's a big difference. So your pelvis was tested for a little bit under 6 pounds, and then I was, you said 8.
8 and a half.
8 and a half.
Mm-hmm.
Yeah, that's a big difference.
Yeah.
So it's not necessarily that your pelvis was narrow, but you had a bigger passenger coming through the passage.
Oh, yeah.
Yeah, so that makes a difference.
Mm-hmm.
Yeah. Okay. And so then you had a C-section.
Yes.
Okay.
It was fine, the section. It's a lot on my... And they did it kind of like, I guess, up and down. Not the bikini cut that everyone seems to have. I have it straight up and down.
Mm-hmm. And then what about the repeat?
It was straight up and down as well.
That's interesting. Usually we just do the horizontal unless like it's an emergency, like to get in immediately. Mm-hmm. So that also could be like provider preference at the time, how they did things. Yeah,
they didn't want me to go through what I went through on that second one.
So through all of your labors and experiences with nurses, did you feel like you were treated well? Like, how would you describe that experience?
I think it was, I was treated well. Mm-hmm. I don't recall having anything negative to say how I was treated as a patient. I think that they did a very good job with me on all 3 levels, actually.
Did you had the same doctor for the last 2?
Yeah, I had the same doctor for the last 2. Mm-hmm. Because the first one was in New York and the last 2 were in Massachusetts.
Going back to what you said, that you had a child and you didn't know anything, right? Did you ever have a conversation with your mother, your grandmother, your aunt, your cousin? Like, any time have a conversation about having sex, how about pregnancy, like sex can lead to getting pregnant, like any conversation like that?
No.
Did you see it on TV? Like, what? That's a different time, though.
That was a different time for me.
Yeah.
I mean, that was, 50 years ago, 40 years ago, so I didn't really have all of that. Because even the young ladies for my first pregnancy, they said, oh, we will see you. I had her on the 24th. They had told me, oh, you'll be back on the 26th. We'll see you in clinic on the 26th. And I said, no, you won't see me. I won't be back. And I had her on the 24th. So no, I wasn't back. My grandmother, they never talked to me about sex. I don't know. My mother, no. I mean, all you hear is not to do this or not to do that, but actual, this is why you don't do this because, and this is this. No, I didn't have that.
Do you think that affected the way you discuss like sex and like body changes, sexual changes kind of that occur like with us, your daughters?
Probably so, because I didn't really do the talking to you all like, oh, I didn't do the talking with you all like now I talk to you all.
Yeah.
What I did do is I bought a book that explained your body, and I gave you all that book.
What's the name of the book?
Um,
Do you remember?
I don't.
Well, the book was What Is Happening to Me, right?
Something like that.
Yeah.
Yeah.
And I only saw it because, again, I love reading books. So I had tons of books, but I don't recall, like, we just had a whole bunch of books. So I just saw it there. And I was like, what is this book? I never saw it. So I was just flipping through it. And I'm like, oh, okay. They had the girls lined up almost like they was in jail. Like they was having their like picture taken. You know what I mean? Like their arrest photo.
Like a lineup.
Yeah, they had them all lined up in terms of like how, their externally their genitalia, breast and pubic hair, all this stuff changed as you got older. And then they also had the same for
the boys,
males too.
Right.
Yeah. Okay. And then so they did talk to you about sex. And so I feel like, okay, now this is all making sense because recently you had a conversation with us telling us that you've never seen what your vagina looks like.
No. Yeah.
So like, what is that a thing? Like, but you're not alone because there's a lot of women that actually don't know what their, external genitalia looks like, which is the vulva area, not necessarily the vagina. I think we describe the vagina as everything, but actually on the outside is the vulva. So like, why did you never looked? You never thought to look? Let me see what it looks like.
No,
I mean, the doctor look.
Yeah, the doctor looked at
everybody else.
Yeah, and whoever else. You're so bad. Your dad can tell you how it looks.
Oh my gosh. I feel like it now makes sense because I didn't think about it, but there's a lot of people that don't know like what all the parts are. So, when we're asking people, they come in, they're saying, I'm having vaginal pain. That vaginal pain could be anything, honestly. It could be from the clitoris. It can be the labia. It could be the vestibule. So the vestibule is the area that has like the urethra, which is where you pee out of that opening, and then the vaginal opening. It could be the vagina. It could be all of that. So we never know.
Right, until we get there.
So I think it's important for people to like just look and see what you got down there. But then I think as providers, we should also show you like, okay, this is what it looks like. This is normal. So you can be aware. I just think more education. The more you know.
Yeah.
The better.
The better for you.
Yeah, because then you'll know if something looks wrong or like, hey, this wasn't here before. You know what I mean?
Yes.
Yeah. Let's see. You've seen a lot of doctors in your life, professionally and personally. Who was your favorite doctor and why?
I'm going to say my OBGYN, Dr. Brownstein was my favorite. Because he had the best bedside manner.
What do you mean by bedside manner?
He talked to you very kind. He explained what was happening. He explained what he was going to do. He didn't he was attentive to what you needed. He listened to what you needed. And then he would try to accommodate you on what you needed along with what he felt you needed.
Yeah.
So it wasn't just one way. He did talk back with you and say, this is what we're going to do, or this is what we're going to try, or something to that nature.
Yeah, so it was a conversation in terms of, what is happening to you, and then, what he thought was best in terms of like
Medical.
your management or whatever, and then gauge from you a plan,
Right.
kind of like how you felt with what he was saying, but then a plan moving forward. That's great. I like that.
Yeah.
I thought you were going to say I'm your favorite doctor, but it's okay. It's okay. I won't cry. So you have a daughter that is now a doctor. But I haven't always been a doctor. So when I told you I wanted to be a doctor, what did that mean? But then also, what was it like to raise a child that wants to be a doctor?
I think that I was excited to have a doctor daughter, but it's just as exciting to have a chef daughter. And it's great to have a singer daughter. So I just wanted to make sure you had what you wanted. I just wanted to be available to each of you for what you wanted to do and who you wanted to be. I didn't want to change you from your thought process. I wanted to help you each be who you, I guess, are today, actually.
Well, it was hard for me.
I'm so sorry.
I feel like I got the brunt of you working with a lot of baby doctors or residents. So like the thing that you saw in them that you didn't like, you were like, oh no, you got to do this, this, and this. Like, for example, the whole writing legible.
That's right.
Like that was a lot. But then like I also got straight A's. Like, I did fine. But then y'all know like the behavior section of the report card where they're talking about, participation, following the rules, like that type of stuff, attentiveness. Like those weren't like stellar. They was like more so like can need some improvement in certain situations. Like, but I would come in with straight A's, but she would get on me about that type of stuff. And I was just like, but why? I'm coming in with the straight A's.
It's because you have to come out here, be out here in the world. And with your straight A, you have to be able to know how to handle people, talk with people in the negative, in the positive. You have to be able to have stamina with the negative or the positive. You have to be on time. You have to go to work. So you have to be attentive at school. You can't miss classes. How are you going to be on time at work if you can't go to school? Unless something's physically wrong with you. If nothing is physically wrong with you, then you can go to school. And same, you can go to work.
Do you feel like the residents that were, you said like arrogant, coming in, a little snotty, did you feel like they probably had a lot of needs of improvement on that part of their report card?
They may have. I wish I had seen it. And I do tell the residents, you make sure that when you, and I ask, how is your parent? How is your mom? Yeah. And they tell me, and I say, well, tell your mom that she brought up an excellent child. And they be like, oh, thank you so much. I said, make sure you tell her. And they do.
So I was a little, like you had to worry a little bit more about me. Or you said that you did.
I did.
So not only was I, your difficult labor and caused you to get cut open, but then after that, I also at some point had to have heart surgery.
Yes.
When I was a baby.
Yes.
So Do you remember like them telling you, oh, something odd?
Something wasn't working right, and they told me that I had to wait. You would have to wait. You would need surgery, but you would have to wait for the surgery. It was not something that needed to be done right away, but it would need to be done if it didn't happen on its own.
Mm-hmm.
So
I guess I should like tell them that. So exactly what I had was considered a
patent ductus.
Arteriosis.
Right.
So patent meaning open, and then it's the ductus arteriosus, which is a channel. So when you're in your mother's womb, right, you're not really breathing. Your lungs are not working. They're developing. So the lungs are kind of like, we're in fluid. So we're getting our oxygen from the mother through the placenta. So that goes through the channel. And so we bypass the lungs and we go straight through to the rest of our body. So the blood just goes straight past the lungs through this ductus arteriosus and then goes to the aorta and then circulates through the body. However, when you're born, then your lungs open up. And so now you're getting oxygen through your lungs. So you need the oxygen to be transferred through the blood, right? So now that area, that ductus is supposed to close, right? So the blood can go to your lungs and then it kind of passes back through and goes through the rest of your body. So that little area closes. Now, and it closes, I think they usually say within like a few days it'll close, or even a few months.
Right.
But depending on the size of it, if it stays open, then you can have more blood flow passing back
to the lungs.
Back to the lungs and back into the heart. So that's extra load on the heart. So I'm assuming mine was small enough that they said I could wait. Now, from what I read, like they said, even you can wait up to the first year of life, it will still kind of like close. But I was the unicorn that it didn't close. Right. So I had to have surgery.
Yes.
And I think at that time, like now they do most of it kind of like minimally invasive. I think they kind of go through the groin and put a coil in and stuff of that nature. But at that time, I feel like I was like a few years off. Like I think they started to do more of that like in the 90s. So I was probably at least a decade off of them doing more minimally invasive. So I have a big scar on my back from them doing open surgery.
Yes.
That's I've kind of grown with.
Right.
But I know like I was reading that sometimes they can do the procedure open, like through the ribcage area. But I'm glad they did mine through the back because I feel like I would want a scar here. Like
unless you really
needed it. But right. I'm grateful that
it's through your back.
Yeah.
Because that's what he told me.
And they can see it now more commonly, like in like you see it in like premature babies, or like more common in girls. Of course, but I was a unicorn. If it was gonna happen, it was gonna be moi. Yeah. So, but I'm doing good, right?
Yes, you are.
I'm like your Tony Sparks. You know, Tony Stark was like Iron Man. So I'm almost like,
You're Iron Woman.
Iron Woman.
Okay.
Yeah. I'm like Tony Sparks. Okay. So recently you had some health setbacks.
I did.
So do you mind telling us about what happened?
I fell at work and I got a concussion.
What were you doing when you fell at work?
I was doing work. I was rushing.
Your correspondence work?
Yes.
The urgent correspondence work?
Yes. I was trying to reach a doctor before he left. And I was rushing. And the next thing I know, I was flat out on the floor in the nursing pod.
Did you trip on something? Was there anything there?
Not that I know of. I didn't see. I don't remember. That's the whole thing. I don't remember. I just remember being up, going, and then now I'm down. And I was down there. I don't know. So I received a concussion. I had an injury to my neck. I had an injury to my shoulder, which is still currently being, I'm having physical therapy currently for that.
Were you still working through all of this?
After the fall? No, I've been out of work 5 months or 6 months.
So that was in
July.
Yeah, so about 6 months.
Yeah, so that happened to me in July. I just returned to work
Recently.
last 3 weeks.
Not back full.
No, I'm only
You're still kind of like
4 hours,
testing.
seeing how my 4 hours do every other day.
So when you talk about concussion, like when you had a concussion, what did that mean for you?
For me, the concussion was quite a bit because you can't see in the light. You don't want the light on. You don't want to be around light. You don't want to be
So this type
around
of
noise.
lighting would have been like,
too much.
No.
I couldn't do it. Noise is too. You can't take noise. I felt like I was bothersome to actually all three of you, and it's just a lot.
Why? Did you feel like you were bothersome?
Because it's just like you had to do too much. Take me to the doctor, bring me back, take me to therapy, bring me back.
You couldn't go to therapy on your own? Like, why?
One, I don't drive. So
Right.
that was one. And then two, you need somebody to go with you because for all these different medical things that you need a someone who can talk for you when you can't talk for yourself, because I couldn't really talk for everything myself. Some things I could talk and other things I couldn't.
So like how you're talking right now,
I couldn't do it.
Through a process, like you couldn't formulate a like full, complete thought.
No, and I couldn't remember things. I only remember a piece. I had to have my medicine time put on my phone so I could take the medicine on a certain time. I had to have food prepared where all I could do is put it in the microwave or just get it out the refrigerator and eat it. I didn't want to talk to people. Headaches. Just want to just lay down and sleep and not be bothered. I had to go to physical therapy. I had to go to cognitive therapy. I had to go to balance therapy.
So it's like the cognitive is like speech therapist.
There was a speech therapist, and that was so that I could get my mind back to going for if I were to return to work, or even not just work, just your brain to know things. You know it, but you can't. You have to bring it out of your brain somehow. And
How was your memory?
I didn't have good memory. I would ask you all, did I tell you something? And you guys would say, yes, you told me this, and this, but this is what we decided. And so I could know. And then you would say, oh, no, you didn't tell me that. What did you want to tell me? And then I would tell you all. But I couldn't remember. I was like, oh, my God, a headache. Very stressful.
So like the whole process of you had the fall and then you were seeing like all these doctors, was that a straight process?
It's like you can't get into anywhere. You have to have someone to go with you, or someone to call for you, someone to call when the callbacks come. You got to have somebody that can take the callbacks because you don't know what they're talking about. You're like, you're trying to tell them what you need, but you can only tell them a piece. And the piece that you could tell them, they don't understand what you're talking about. Or if they do, sometimes they don't care, or they're not concerned, or they don't book you the appointment, or they book you the appointment and then you go there and you don't have an appointment. It's just a thing that's terrible. It's terrible.
Did you get everything taken care of all at once?
No, your body when you injure yourself, there's certain places, every body part has a different kind of doctor you have to go to, even if it's in the same building. It has to be a different doctor. It can't be the same doctor taking care of your neck and your shoulder. It's
So
a
you had
whole
two different doctors for.
I had a different doctor for the concussion. I had a different doctor for my neck. I had a different doctor for my shoulder. I had to go to a different place to help my neck. It was not good. It just, I mean, the people that I went to, they were very good and thorough, but it's a lot to go to all these places. I learned how to use my calendar on my phone really well because everybody was in there, every therapy, every doctor, every kind of appointment.
So almost every day you were kind of going to a different
everywhere
place.
to a different place. Every day was different. Maybe one day out the week I didn't have somewhere to go, but
Right.
people think you're just home. No.
Yeah. Because the therapies are all under therapy. However, you can't go to two different therapies on the same day.
On the same day.
You had to like break it up in terms of the insurance
Right.
for the coverage for it.
For the coverage. Yes.
And then they decided also like how much therapy you would get as well, right? Because your insurance only covers a certain amount for.
You only get so many. You only get like 12 visits or 16 visits. It depends.
For like your calendar year.
Right.
Yeah. So the worst part for you was more like initially at the beginning, headaches and neck pain, or was it all the same?
No, the headaches and my neck. My neck. My neck, I believe, was the worst of all of the pains. And once you get on a medicine regimen, that helped.
What medicine regimen?
I had to have something for the headaches. So that regimen, taking that medicine, well,
Kind of titrating you up to see what was
the best. And then for my neck, I had to go to get an injection in my spine to
almost
help.
like the spinal, like you had for labor, but now this was upper in the neck.
In the neck.
Yeah.
And I needed to get that in order for my neck to calm down. And then also have the therapy. So you need all of that and take the pain medicine for the neck. So you're doing a lot of stuff for the individual body parts.
Yeah. And that was like at least 8 weeks of the time frame. And then you kind of had a setback in terms of trying to get into balance, but then you finally got that.
And that balance therapy was to be able to stand, and when you're walking on not level areas, you can be able to walk level and still see and be able to look around and see yourself walking, and standing up and down and pulling yourself.
Like moving your neck. I know
Yes.
she did some stuff like that.
Yeah.
Okay.
Quickly, neck movement correctly, this type of thing. Sleeping, you can't sleep. So it's a lot. It's a lot. It was a
And
lot.
you say can't sleep because of pain, or you just were like
Because of
overdosed?
pain. Because of pain, you can't sleep. And being awake. And then when you do get to go to sleep, it's in the midday. It's in the afternoon. You're finally going to sleep.
So that's what also was hard, kind of get into a schedule, because you have the concussion. So in the concussion, they really want you to be on a schedule
Right.
of sleeping and then being awake.
Right.
And they mean not
Yes.
having too much naps.
Right. But if I felt anything getting ready for my head, I needed to go lay down,
Yeah.
which I still do.
So that's kind of a trigger. Like, if you're doing too much,
Right.
if you like start to kind of like get a headache.
Right.
Okay. Because I remember like we listen to music a lot, like when we're driving, but like at the beginning, like,
We
we
did.
just drive in silence.
Right.
And I would gauge just kind of like how you were looking if I would turn the music on. I think we slowly start listening to music again, of course, now, but it was very much more like, okay, let's see. She looks like she's in pain. We'll just not use the music.
Yeah, you have to be the caregiver of people, you got to pay attention to the patient and see what's going on with them, whether it's your family or someone you're taking care of in the office.
And then we finally, after having a little setbacks in terms of getting the speech therapy actually done, we found someone
Yes.
that I drove you to because I was like, it had gotten a little crazy. So we found Robin.
Yes. Her name is Robin, but I call her Robina.
So we found Robin, and Robin was pretty amazing. Like, I must say,
She is.
when you first went to her, you were very nervous.
I was like, oh my God, what is this?
Well, I think you were like having anxiety because like you feel like you don't do well on tests. So you thought she was giving you a test. She was
giving me a test.
Yeah.
And then she also, it was gauging my age and gauging what was wrong with me. And I think all to see what she needed to do for me to help me.
Yeah.
So that's
because as we were saying before, like you just kind of told us all the things that you need to do in terms of the organization, the processes of getting people's paperwork, how that whole cycle goes. She needs to understand, okay, the work that you do, okay, now how do I get you back there?
Right.
In terms of your mind and you, you know, think of things concrete, but then also even more so spatial or,
right.
I don't know how she described it, but just to kind of make you think in different ways.
Right. And she
like to see how your brain would work.
Right.
We talked about like memory recall.
Right.
Like if you couldn't remember a word.
Yeah, because she would say, just a minute.
Yeah.
Tell whoever it is, just a minute. I will find it out. It's nothing wrong with it that you don't remember what it is or what it's called.
But if you couldn't remember the word rabbit or bunny or something like that, she would talk about describing it.
Right.
You know what I mean? Describe what you're talking about and then it'll come to you.
Right.
So she had a lot of tricks. Are you still doing the work that she told you to do?
I am. I'm still doing the work. She'd be proud to know that I'm doing Sudoku.
Sudoku?
Yes, I'm doing that. And I'm doing crossword puzzles. She told me whenever you are watching these kind of things, because I watched the puzzle and when I'm home. I don't know the name
of it. I know what you're talking about.
But she told me try to know the answer before the answer comes on the thing, and that's what
So be like interactive, like active, like,
right?
Yeah,
with the people
on the TV. Yeah. And like you said, you just started going back to work. So how are you like feeling? Only a few hours, but like, are you excited to go back? Were you nervous initially?
Yeah, I was nervous. I was nervous to see all the people, but the people welcomed me warmly. Everyone hugged me. Some hugged me so tight. Some kept hugging me and then wouldn't let go. They all were kind. The work has been split up like into like let's see, 1, 2, 3, 4, 5. Like about 5 people doing my work that I was doing alone, and they all were contented that they have helped me and not worried about it. And they're like, they just want me to be better. And they ask me now when I go home, because I only work the 4 hours 3 days a week. They want to be sure I'm okay when I leave. They want to be sure I'm okay walking. The doctor, one of the big doctors, he says to me, okay, you walking? And I'm like, yeah, Dr. B, I'm walking. So
Well, I said you can't wear the shoes that you had on.
I had a little sneaker with the...
No, you can't wear that brand anymore.
Which one?
What did you have on when you fell?
Oh, no, those are Crocs I had on.
You can't wear them no more. Those are retired shoes.
I had Crocs, my pink Crocs.
No one should be running in Crocs. Like, it's very dangerous.
Don't run in them.
Don't run in the Crocs, please. Don't walk fast in the Crocs.
That's how I was walking really fast. I can't run anyhow because of my knees. So.
And then when you were out, actually, one of your doctors used to be one of your residents.
Yes.
So that was your concussion doctor.
That's my concussion doctor. Yes.
And
awesome doctor. He's awesome.
Yeah. He actually had a resident with him at the time. One of the
He had
times that we saw
a
him.
new
Well,
resident.
actually, a few times he had different residents.
Right.
But I remember kind of one of the last ones.
She just came
Visit
in July, but she was there as a medical student.
Yes.
Yes.
So one of the things she said to you is like, you were the reason why, like you were one of the reasons why she picked this residency, you know, because of how nice you were. So like, how do you feel about that?
I wanted to cry.
Your impact.
I wanted to cry because I didn't know what I did. All I did was make her feel comfortable and at home here with us, because you're away from, like I said, your family and whoever else, you know, you're around.
Yeah.
And so that made me feel happy. And I think I wanted to cry. And I feel like I want to cry now about it too, because, and she's a very nice person. She really is. So I told her, just be who you are. Be your good self.
How does your experience, like recently with the concussion, you're seeing all these doctors, how do you feel that will change you personally or professionally in terms of how you practice medicine? Because I feel like you are a part of medicine, right? How do you feel like being the patient, going through what you went through, would change how you show up to work and serve other patients?
I would be more kind, especially when they don't know our language, when there's something wrong or when there's something that they need. I would be more kind and try to help them more than I already do, because they can't do it by themselves, even if they have those who can speak for them. I would look into what they need when they're asking for it. I would take my time, be more timeful to people, if that's a word.
Well, you just said it, so it's a word.
All right.
You still say you're still doing therapy right now on your shoulder?
Yes, I have. Yes.
What's all it is?
Because it hurts.
Oh. But your neck hurt at one time and now it's better, right?
Yeah, and I always watch it. My neck extra. My neck is extra. I watch it extra because I cover it. Matter of fact, I cover my neck because I feel it needs extra.
Yes.
So.
And we did a lot of work, girl.
This neck.
We're not going backwards.
This neck can't take, you know.
I think the awesome part about it is that the person that's working with you for your neck, shoulder, you've seen them before. So that wasn't a new person, right?
No, he done worked on both my knees. And, yeah, both my knees, my neck, and now he's working on my shoulder. And I also have the other ones who assist him. They've worked my neck and they're working my shoulder.
Yeah.
But my knees.
So I think that was actually good that you had new and old faces.
Right.
You know what I mean?
And all the people in there, they know me.
Yeah. So now we're doing all that because we were focusing on the acute issues. And then we had to kind of catch up on the screening stuff. So we recently went and got mammograms done.
Oh, yes, we did.
Yes.
Oh, my gosh.
I never thought about it, who kind of goes we could kind of make it a date. Was almost okay, let's go get our mammograms together. You know what I mean? And I think some people that are maybe afraid to go get the mammogram done, they probably should just go with somebody else.
Go with somebody who they know.
Yeah.
I mean, their family. Because when the lady took me, she said, we usually get sisters that come. Is this? And then she just looked at it. She said, oh. And I said, no, it's my daughter. She said, oh, that's so nice. Mother and daughter are coming in today.
Yes, we had to get the girls looked at.
Yes. And I tell you, they have to figure out a whole new way to work this machines. for the girls.
So how was your experience this time? Because I actually had 2 experiences, so that's why I kind of bring it up.
This was fine.
Yeah.
The other time it was just like I was a pancake.
Even with your shoulder?
Even with my shoulder, but I was very careful with my shoulder, what I lift up my arm and do.
Yeah.
I didn't let her just do my arm.
Yeah.
You know, I'm very careful with this side because it's hurting.
Yeah. The mammogram I had done last year, that one I was like laid out. That one was so painful. I felt like somebody like ran over me, like with a bus.
And I've had that kind before as well, where it's just like, oh my God, they break me?
Yeah.
Or is something broken up here? Or what's happening?
I don't remember if it was like during the time of like my menstrual or anything like that, but that one was more painful. I do know like certain times when you have procedures, like your skin is more sensitive, like around your menstrual cycle. So I don't know if that was the case. This time, I mean, it was
sore.
Somebody squeezing your breast. So yes, it's uncomfortable, but this time I didn't have that because last time I was laid out for like a whole night.
Yeah.
This time I took Tylenol after and then
I was fine.
I was fine. Yeah.
But maybe it's because I have the pain in the shoulder too.
I don't know. I don't have no pain.
So I
this
don't
one
know.
was good. So yeah, right. You should make it a date.
Yeah, you
your
should.
Sister, your best friend.
Yes.
Whoever. You know you got somebody out there that needs to get their mammogram done. They behind. Just say it's very easy to schedule. Like it wasn't. No. I didn't wait that long.
No, it was quick.
Yeah, it was pretty quick. Okay. So I feel like we talk a lot in terms of generations. You know, I like to get like your perspective on things. You know, you're older than us, of course. But then I feel like sometimes, you know, even the younger generations, I like to talk to them, but because I feel like I'm in the middle. But like, I feel like the generations don't talk. You know, like the younger people think, oh, the older people, they too old. They don't know what they're talking about. Or then the older people will be like, you know, they're talking to them, not talking to them, if that makes sense.
Right. It's not with them.
You know, you're not like having the conversation. Even as you said, when you were 20 years old, you know, I feel like you could imagine how you felt where people were basically like talking to you, not
with me.
Talking with you. So what have you learned from your life? Are you doing things differently?
Well, I do a lot of things differently than then. I mean, I had to learn how to use my phone, period. I didn't even know how to use a phone, how to put names and stuff in the phone. So I've learned a lot of that from all of you, between you and Sheena. I've learned that. That's my middle and my youngest. And you have to learn, your children are quick. You're slower. Some of your children have more patience with you than the others.
But then sometimes you'll just be like, just do it. So then you never have time to actually learn it. So that makes a difference too.
Right.
Yeah.
So I've learned how to use my phone better. I still have things to learn with my phone, but I've learned some of that. You know, I've learned different medical things from you, which is good, but I've also learned other medical things from my other daughter who, you know, from her being sick. So when you have the families that have different things, you find out the information from them. So, you know, I've learned a lot of little
but then things. You also learn stuff. You work with doctors all the time. Like
right.
You literally, that is what you do.
Yes. And then I may ask them some questions about something that I don't know that I may need to know. Because I know them. They'll tell me. You know.
You're at the time where we were also talking about kind of when you were sick, kind of almost like the circle of life. When you were younger, you were taking care of us. And now we're older and now we're helping take care of you. But this was more so like, especially before you fell and had your concussion, you were very, very independent, doing everything on your own. Other than driving, you don't drive, but
yeah, I was doing everything.
Yeah.
But now I had to have you all help me
Yeah.
with everything.
Mm-hmm.
I was just, you probably know all my everything information like it was your information.
I do.
Because you thought it was you. Because they would ask you and you'd be like, da-da,
Yeah.
ding, ding.
I filled out so much paperwork.
For me.
Oh
See,
my gosh.
that's a lot.
It was so much paperwork. I cannot imagine anyone doing this on their own. There's no way. There's no way.
You need somebody.
There's no way.
You need every person. If you cannot do it yourself, you need to have someone to help you with all these different medical things because it's too much.
I mean, we haven't even touched on the insurance part of it.
No.
You know what I mean? Like the disability part and
That's
filling out that. And then, you know, getting paid, how you're getting paid, what you're taking out, you know, like all the things. Like that's just a whole nother.
That's another part.
A whole nother conversation. And then the insurance people call you and they're like, well, what's wrong with you? And you're like, she can't formulate a conversation and tell you what's wrong. And then they're upset when you have someone else talking for you because you're like, I can't do that. Do you know what I mean?
Yeah, so that's the thing that people need to know. If your patient cannot physically do it, you need to let them know this person is going to be talking for me because I can't do it.
Yeah. Did you feel like you were burdening?
Yeah, I felt like I was burdening you. I was like, she needs to be at work and she needs to be doing her own stuff. And this one needs to be over there doing her stuff. And then you get a call for that other one over there. And it's like, I just felt like I was just taking you all away from you all's own personal duties of yourselves, you know. But you let me know that that wasn't the case.
No, not absolutely. I mean, like, yes, it's tiring. That is a lot of stuff that you have to do. Even if you had to do it on your own, do you know what I mean? That would be a lot. But if your mind is not working and your mind is trying to heal, like your brain is literally trying to heal from a trauma, I think it's important. I mean, it's acceptable to have someone else helping you. But I feel like I wouldn't have no other way. Like I wouldn't have no one else helping you. Do you know what I mean? Because one, I know the system as much as possible. Like I know what the doctors want to hear. You know what I mean? Or the order of like, I know how I want to type it up. So I know like in order what they want to hear. But then also, you know, it's helpful because they're going to ask me questions more so like, how is she doing with this? Like, is she sleeping? Some stuff you wouldn't even tell them. And I will have to tell them because I'm like, girl, you got to tell the people. Otherwise, like,
yeah, well, I didn't know what
like
to
you
tell
gotta
them.
get better. You know what I mean? Or like you're not sleeping or you're doing this or this is working. So you have to have like somebody else. But I feel like it was a good time. It was perfect timing because I had worked a lot during the summertime. And then I was like, okay, I'm going to take like a break, like a woosah. And then, so in that time frame, that's when you fell. And so I'm thinking I'm taking vacation. And then God was like, no, girl, like you need to take care of one of my strongest soldiers. So it was like, again, perfect timing. Do you know what I mean? It wasn't like I had to move too much around. Mostly my life or my schedule was kind of your schedule. And I just did stuff around you. And it worked out. So I think things happen for a reason. Like I'm put in a space. Like I'm in a space in my career where I could have done that. You know what I mean? Or like, you know, doing the hospitalist work, like I had a little bit more flexibility that I can move around and be like, this is the only times I can work because I'm taking care of Madame, you know? So it was great. And I got to spend a lot of time with you. And we did a lot of things. So it was awesome.
Yes.
Yeah. So we watch a lot of sports, your children, at least me and Sheena. So now you become a sports watcher by default. It's one of the things we do in our pastime.
Yeah.
What's your favorite sport to watch?
By default, I think it's basketball.
You don't got no choice.
I have to watch it every day. I'm not watching it now, but it's every day.
Yeah.
And it's not bad.
That's because of Sheena. Sheena is diehard Celtics fan, my youngest sister. Diehard, crazy.
Yes.
Crazy about the Celtics.
Yes.
Yeah.
If they all could come, she would cook for them and do all this stuff that she has in her mind that she wants to do for the Celtics.
Yeah. So, all right. So, Madame, you have a birthday coming up.
Yeah, that's a
What are we celebrating?
70th birthday.
70 where?
Yeah, 70th.
70 where?
Yes.
Do you get that a lot?
Yeah, all the
Like
time.
when people look like 69, like, who are you 69?
Yeah, no one believes me. They want to see my ID to see, are you telling me the truth? And I'll say, yeah, I'm going to be 70.
How do you, what would you recommend for the usefulness? Is it just being kind? The way you are? What is it?
I think I don't do anything, so I think maybe it is being kind as you can to others, even when you don't want to.
But you're kind to the point where even when people are not kind to you, like,
It's all right.
you're still
Kind.
because I feel, well, just thinking about it, that says more about you than them. You know what I mean? You shouldn't change because of other people.
No.
Yeah. So 70 coming up.
Yes.
How are we celebrating?
That I don't know, because we've been doing a lot. We need to go on a trip, but we can't go on a trip because this world is going somewhere.
The world's going bananas.
It's
We can have a trip in the house.
Yeah, we'll have a trip in the house. Yes, trip in the house.
I feel like we're becoming Broadway connoisseurs because last year we went to Broadway.
To Broadway.
And what did we see?
The Wiz.
The Wiz.
Yes.
The Wiz was brand new.
Oh, it was. And it was awesome.
How'd you like it?
Awesome.
It was good. Yes. It was good. We need to go back. Honestly, I think I don't know if they're on tour or they're going to be on tour, but I want to see it again for sure.
Okay.
And then for my birthday, we went to see recently. We went to see Six.
Right.
They were touring.
Right.
I like that too.
That was good.
Nice. That was good too.
That was good.
That was a cute one. Like, that's cute. You know what I mean?
Right.
It was an in and out. It wasn't, too much. Because most of the time when you go to New York, that's a full day. But this was only like 90 minutes. Okay. Didn't have any intermission. It was very cute. I liked it.
Right.
Yeah.
It was cute.
Yeah, but we definitely have to see The Wiz again.
Yeah,
I mean, I have like a special place for The Wiz because you know how we did our church musical.
Right. And that was awesome how y'all did that.
Yeah.
I really liked that.
And I was Scarecrow.
Yeah.
And so there used to be like a costume place because we rented that costume.
Yeah, but I don't know about all that stuff that you guys did. I don't know.
We rented that costume, but like
I don't know how.
Like all the nice little boutique stuff was like we don't have that stuff no more. I don't even know where
that was gotten at, but it was pretty nice.
That was nice.
Pretty nice.
All right, my friend.
Yes.
If I gave you $1 million, what would you do to change medicine?
I'd have a person for everybody who needed some help to be there for them.
What you mean? You say help? Because I need help, girl, so you're going to have somebody for me?
If you need them.
Okay. But what type of help? Are we talking about like in health?
In medical.
Yeah.
To take them where they need to go for their different medical situations. Mm-hmm. To help them fill out their paperwork as they're sitting in the waiting room, to go in to see the doctor. Because everywhere you go, you have to put how many times did you have a headache? Do you have this? How far is the headache? How is this? What is that? So somebody help me fill out this paper so that my brain don't have to fill out this paper. Mm-hmm. So I would get a person for every person that would need it.
Yeah.
You come in, you need it. Okay, the person's coming out of the back. Here they are, right here to help you or drive you where you need to go. Oh, okay, you have appointment coming up. Here, we helping you. Do you need that service? Yes. And not the service where people are going to take advantage and take your money and all of that stuff. You don't have to pay for this person. It's paid for because there's a million.
Okay. I think we're going to need a few million
Well,
to do that for everybody.
Well,
but if I give you $1 billion to change the world,
now we discussed that one.
you can't do.
I can't do yours, what you said?
No, what you said.
What? Oh, I can't do
No.
what I said? All right. But I can do what you said.
What did I say? Well, you can't do what I said.
Why?
'Cause that's what I'm going to do.
Well, then we both did it. Right?
Okay. Well, I take your money.
Okay. And we'll just pour something on people and let them be the best that they can be.
Yeah. Well, I feel like initially when I told you I was going to do it, I said spray and lotion.
Well,
But now I'm thinking that I would do soap and lotion. Because spray, you don't necessarily have to use it.
right.
You know what I mean? But I feel like most people don't want to be ashy. And also, you don't want to smell and be dirty. So you got to use soap.
Okay.
So if you want to do something with the spray, because you like sprays, because you have a lot of sprays, which is fine. The girl wants to smell good. But if you want to do something with sprays, you can.
Okay.
But I'm definitely doing the lotion and the soap.
Okay.
Because people need to be clean and they need to be moisturized.
If they use it.
But if the person doesn't use it, then you know not to go around them.
That's it.
You know what I mean? So then they'll be by themselves and they'll be ashy.
Okay.
And they'll be angry people.
We got a lot of them, but we want to help them.
Right. So lotion and soap.
Okay.
Okay. Very good. All right. Now, what is our silence prescription for today? What are the gems that we want our audience, our community to take away from today, from everything you said?
Chop, chop, and let's go.
What does chop chop mean? Because I did ask you earlier. So what does chop chop mean?
Chop, chop means let's go. Do your work. Do it. Do it. Do it. Cut through. Let's get it going. And let's go. We can do this. We can do this.
So when you were at work, you just tell people, just
Yeah.
chop, chop, let's keep going. Doesn't matter what your mood is. It's
Doesn't
okay. We move it through.
That's it.
Yeah.
I tell my big boss that. Chop, chop. And that's what he says to me. Chop, chop.
Okay. This was good. How'd you feel?
Okay.
Yeah.
Yeah.
Well, I like to say, as I've told you already, but like the Unspoken Medicine, like this podcast, I feel like is your legacy. Because I feel like you said before, you know, and I don't know who it was, but you said someone at one point in your life told you, you are never going to do anything or you're not going to amount to anything.
Yeah, I'll
You know what I
never
mean?
be anything.
You'll never be anything. Now, why would somebody say that? I don't know. When I think about that, I think that person just wanted you to feel less than them. Do you know what I mean? I don't know what the situation was. But even if you did nothing else, you had 3 beautiful daughters that are doing amazing things and impacting the world in different ways. And so if you didn't do anything but have us, you've done enough. Because I saw what medicine was, you know, for its true self, how we treat each other, even in our own healthcare system, as physicians, as, you know, ancillary to medicine, we still don't treat each other right. You know what I mean? So how could we imagine treating our actual patients that don't know things? So it was just eye-opening to me, you know? And so I also feel like that pushed me to do this podcast. So I just want to thank you for falling and busting your head.
Wow.
No, but seriously, like I met so many different people. Do you know what I mean? And just got a different perspective, even as an advocate for a patient. Like it was a whole different experience for me seeing it as a physician. Like that was mind boggling, and just to be aware of how we're seen, like how the healthcare system is seen. So if anything, this your legacy, girl. This is me, doing this and talking to so many people in the system, which is going to be helping other people, like the impact that we're going to bring with this podcast, like that is your legacy. So if anything, you should be proud of that.
Thank
Because this
you.
is all from you, madam. You have birthed all of this.
Thank you.
You give your body for all of this. So yeah, I'm excited.
Well, thank you so much.
Yeah.
I appreciate you.
Guys.
All right.
Well, I'm so excited that you came to the office today. Hopefully you enjoyed this conversation. I'm really happy that you were able to tell your story about, what happened. Because I know that it's going to help people. And I think it's going to be very impactful.
Okay.
Thank you for being my guest today.
You're welcome.
All right. Thank you guys for watching. Again, if you got anything from this conversation that I had with my mother, feel free, definitely write in the comments. Let me know what you're thinking about. If you really enjoyed it, like this video, and then also share it with somebody else. Until next time, take care of yourself and also use the good medicine that's inside of us to be our best selves. All right, take care. Thank you. Bye. Okay. And